June is Men's Health Month, and that's what brings us here to Sweatnam Cosmetic Surgery right here in Johnson. We're going to go inside because Jason and the team are getting ready to try out something that the team here is seeing, Brotox. Let's go inside and check in on Jason. Okay, so now is the moment of truth. What we're doing right now is getting Jason prepped to get his Brotox treatment. Joining us, we've got Dr. Sweatnam and Amber. They are here. Hi, everybody.
Hey, how are you?
So it's great to be here in the office with you, Dr. Sweatnam. You've been coming to visit us for the past couple of months, so now we're here kind of in your domain, so we're excited.
Yes.
It's where the action happens.
Yeah, absolutely. So talk about what we're going to be doing on Jason today.
Well, obviously, cosmetic surgery, Botox, all these things, not for just girls. Guys can get them too. Father's Day's coming up.
That's true.
Dad, look at Dad. If he's all wrinkled up, this may be one of the things you can do for him. But this is a very quick and very easy way to eliminate a lot of wrinkles in the face, especially those pesky horizontal lines, the 11s, crow's feet. Those are the most typical places that we treat.
Okay.
And that's what we're going to do today. For all the neurotoxins, they are injected the same way. We target the same muscles.
Okay.
We're kind of trying to treat and even out a tug of war that's constantly going on in the face by slowing some muscles down and allowing other muscles to work better.
Okay.
And that's how it works. And Amber's our nurse practitioner. She's really good at this, and this is what she does all the time. So she's shooting him up right now as we're speaking.
Hey.
Yeah, baby.
Doing okay?
And you don't hear him yelling or anything.
That's true. That's true. He's very calm.
You know, we use the smallest needles that we can get. The biggest complication you can have from this generally is some bruising.
Okay, sure. For first timers, Dr. Sweatnam, what are some things that we need to know about getting Botox?
Well, first, don't be afraid of it, because it really is a rejuvenating deal. I mean, all of a sudden you look in the mirror, you kind of think, man, I'm looking good, you know. And then 4 months later, you look in the mirror, and you're like, I'm kind of starting to look tired again. It's time to go back. But it's just it's an easy process. These toxins have the safest safety profile in the doses that we're using.
Okay.
So it's extremely safe. One of the safest safety profile of any drug on the market, because it is a drug, and it works really well.
Okay.
We have years and years of experience with it, and it's really good.
Sure. When people come in and maybe they do a consultation, do they tell you kind of the areas that they want to focus on, or do you help people kind of identify those areas?
Well, they're very typical. I mean, everybody makes the mean face, everybody looks surprised, and everybody squints. And so we all get, I mean, rarely do you see lines that are not horizontal in the forehead or vertical in the glabellar area, the central area, or little lines of crow's feet around the eyes. I mean, those are typical muscles of expression that we all have, and those are the muscles that we're shooting for that create those wrinkles.
We've been watching Amber. You've been injecting Amber, but I've also saw you use like a globe. It seems like you're doing some things to kind of maybe numb Jason's face. Is that what you're doing?
Yes, this is an ice globe, and it's really good for kind of icing the skin right before I inject. It kind of helps numb the skin superficially, so the needle isn't as severe and as painful going in. So, and then we usually give you an ice pack afterwards too, because you'll have about 20 minutes of swelling, and you may see immediate bruising, but sometimes it doesn't happen for a day or so. But yes, it helps with inflammation.
Jay, how you feeling?
I feel great. I mean,
How'd it feel?
Didn't really
hurt.
I mean, it was a little prick maybe, but not really that painful.
Yeah.
Okay. What's some post things that people can do after they get their Botox?
So you can leave here, go right back to work. The worst thing that can happen is you might have a little bruise.
Okay.
We don't see that very often with experienced injectors. You usually don't get that. Well, anytime you stick a needle in there, you're damaging little blood vessels, and so if you increase your blood pressure, increase blood flow, your chance of causing bruising and things might increase.
All right. Okay. So Jason's got his Botox in,
Yes.
and how long did you say it would take for us to see some onset?
Usually, for the bigger muscles, you'll notice it 5 to 7 days.
Okay.
Now, you're going to notice gradually these smaller muscles around the eye by this afternoon, even maybe.
Okay.
Definitely by tomorrow.
Okay. So we'll be taking pictures of Jason
Yes.
From today, and we'll
progression.
do a progression so you can kind of see the difference. But you're feeling good.
Yeah, I feel great. Yeah, that's no big deal at all.
All right. Hype it up, Amber. Doing more. Dr. Swetnam, Amber, thank you so much for welcoming us today and also walking us through the Botox, or in this case for Jason, Brotox.
The Brotox.
Brotox.
We'll be right back with more Good Day in WA.